Welcome to the Innate Life Health Complex. Today we are discussing knee pain, neuropathy, and the programs that we have right here in the office that have helped countless patients regain their freedom without drugs and surgery. Now, before we get into our programs, let's look at some studies that have been conducted recently as far as what the medical profession has to do with this. At the top, you can see printed in the British Medical Journal. Knee surgery does not improve life quality for many patients. Why is that? Because more often than not, people who have had knee surgery or replacements, they still have knee pain. Just below that, the second line, steroid injections increase cartilage loss with knee arthritis. Steroids are really great at decreasing inflammation, but another thing they're excellent at is dissolving cartilage, weakening tendons, and sucking the minerals out of bone. We call that osteoporosis. So the latest and greatest are not really the best options for a lot of folks. Now, if you look here, this is a view of the leg. We have the front on the left side and the back on the right side. Lots of muscles in red, lots of tendons in white. And the tendons are going to become very important a little bit later on. But it is a very complex joint. It's supposed to function like a tight door hinge. And what often happens is that over time, people walk in a straight line. We're linear. People don't change direction rapidly and challenge the muscles on the inside and outside of the leg. So now, rather than functioning like a tight hinge, the knee has slack to it. It has wiggle room. It moves in ways that it's not designed to. And the brain recognizes this, and it tells the tendons to shorten and tighten up. This is called a tendinopathy. This is where the pain comes from. There is no pain from bone on bone. Did you hear that? There's no pain from bone on bone. How do I know that? Because I understand the anatomy. There's a piece of the anatomy that many people have never heard of before. That piece of anatomy is called the periosteum. Periosteum is a dense membrane that covers the surface of all of our bones, and that's where the nerves are housed. If you've ever eaten ribs, and the ribs are a little overdone, when you pull the meat off of the bone, there's that milky white membrane that will peel off the bone surface. That's periosteum. Now, here's the thing. Periosteum covers the surface of all bones except for the surfaces of the bone that's capped with articular cartilage. What does that mean? It means that there's no periosteum inside your knee joint. So if you are in fact bone on bone, it's not possible for that to cause pain because there are no nerve endings inside the joint. Now, if you look here, these are the 4 stages of knee arthritis. Stage 1, looks like there's pretty good joint space, no bone on bone. Same for phase 2, same for stage 3. Only at stage 4 do you see that the bones are actually touching. But here's the thing. Stage 4 only accounts for about 5% of the population who has knee pain. 5%. But they're the only ones that have true bone on bone. How's this possible? What ends up happening is that whenever the joint is moving in directions it's not designed to, the brain recognizes this and it tells the tendons on the front and back of the knee to shorten, tighten up, make that joint tight again. But it doesn't make it as tight as possible. So the next thing that happens is the body will recruit fluid into the knee joint. This takes up space. It's called a self-casting mechanism. So now the tendons are short and tight. There's fluid in the knee. It functions very similarly to when somebody sprains an ankle. First thing that happens, the joint tightens up and the ankle swells. The knee is no different other than this happens over a very long period of time. So what are the signs and symptoms of this? People can't squat down to the floor. They have a hard time with hilly surfaces like the pitch of their driveway. Stairs, especially going down. Limited flexibility, such as they can't bend over and touch their toes, or they can't pull their heel up to their butt. This is not normal. And folks will say very often, oh, it's because I'm getting old or I don't stretch. Not necessarily. I know plenty of older folks that have remained active and are not linear in their motion. They don't just walk in straight lines. They do activities that make them change direction, like playing pickleball or tennis, or maybe even or pick up basketball, things like that. And their knees are fantastic. So the name of the game is not bone on bone. The name of the game is tendinopathy. We have to get rid of the tendinopathy. We have to allow the brain to tell the tendons to relax while simultaneously strengthening the weak muscles on the inside and outside of the leg. And we have to do this because we need to make sure that people have fewer and fewer knee replacements. Your average knee replacement is between $35,000 and $65,000, and that's just the surgery. That's not hospital stays. That's not rehabilitation, co-pays, PT, time to and from those appointments. And the thing is, 90% of them only last about 10 years. 1 in 4 people will require a second knee replacement on the same knee. 1 in 5 will report post-operative pain, as in chronic. They have it forever. Their pain is actually just as bad, if not worse, than it was before they had the knee replacement. Why? Because nobody addressed the tendons that were actually causing the pain. What we have is a device called the Neon Track, clinically proven to reduce pain and increase mobility in patients with chronic knee pain and degenerative joint disease. Next up is neuropathy. Neuropathy is damage to the nerves in the peripheral part of the body. So typically in the hands and feet, it's a loss of sensation, a loss of function. People can't differentiate between hot and cold. They can't feel light touch, or they have extraordinary pain whenever they encounter these things. Numbness and tingling, sensitivity to touch, weakness, loss of reflexes, cramping, bone degeneration, all of these things occur with neuropathy. What causes neuropathy? The most common is unmanaged diabetes. People with diabetes are far more prone to neuropathy than the general public. Another form is called idiopathic. Anytime you hear the word idiopathic, that means they don't know what's causing it. And about 23% of neuropathy is idiopathic in nature. They just have no idea what caused it, but nonetheless, people can't feel their feet, or their feet are constantly burning and on fire. Alcohol abuse will cause neuropathy, as well as cancer. Chemotherapy absolutely destroys the nerve endings and will cause neuropathy. And it is through that the device that we offer here was developed. Some of the complications of peripheral neuropathy are burns, infections, falls. Why falls? Because people can't feel their feet. So they'll step off of a curb, they'll trip on the carpet. And what is the one thing that an older person does not want? That is a slip and fall, because those often lead to broken, fractured hips. And 1 in 3 people who end up in the hospital with a broken hip does not exit that hospital. What we have is a device called the Rebuilder. It's FDA registered. This device was developed by the American College of Cancer Research. Why? Because as said previously, folks who have been on chemotherapy typically get neuropathy. Now, what's another part of this that we're missing? X-rays. How do we know what's causing your knee pain? How do we know what's driving your neuropathy? One of the best tools that we have is an X-ray to look at the state of your spine. Why? Because the nerves from the low back go down the leg to the knee, and they go down the leg all the way to the feet. And if those nerves are being pinched, crushed, damaged at the spine, that could be the cause of your problem rather than any of the other. So this is a current patient. She has just completed our knee program, but she's also under chiropractic care. Why? Because if you notice the X-ray on the right, you can see that she has a curve in her low back. Right? Her low back shifts to the right. It throws off her center of gravity, and she's carrying more weight on the right-hand side. On the left, you can see that the very bottom disc is crushed and that her entire spine has shifted forward on the last vertebra. So that is causing a lot of pain and it's impeding her nerve function, which ultimately directs healing of the knee. Now, this lady also had a knee replacement on the right-hand side. But here's the interesting thing. You can see that on her left knee, the one that was not replaced, you can see on her left knee that she is not bone on bone. She has space. But here's the thing. The knee that she got replaced, she reports her pain being a 7 out of 10. That's her good knee that was replaced. Her bad knee, she reports as being a 9 out of 10. So 2 years ago, she had a knee replacement. It's a complete knee replacement. There's no bone on bone. It's not possible. And yet her knee still is a 7 out of 10? Huh. Well, if bone on bone causes pain, how is that possible? It's not. And then we have this gentleman. This gentleman came in with neuropathy. We looked at his low back, and as you can see, he has an L4, L5 disc being crushed, as well as an L5 problem. This man is undergoing decompression as well to address the root cause while simultaneously doing the home neuropathy protocol. So I hope this was helpful and informative, and I look forward to speaking to you very soon.